More experts are recommending lowering the age for people to begin colon cancer screenings. The U.S. Preventative Services Task Force is officially lowering the age to 45 years old. It had been 50. The revised guidance follows 2016 recommendations from the American Cancer Society, which also lowered the screening age to 45. For more on the change, we're joined by colorectal surgeon Dr. Ankit Sareen. Doctor, it's good to have you on here to break down exactly what's going on. What are the key factors that you believe led to this shift in the guidance?
Thank you, Mark, for inviting me. I think we've been noticing for a few years now, at least a decade, that the age of colon cancer patients has decreased significantly. In the past, it used to be a disease of the aged, in the 60s and 70s, but more and more we are seeing patients in their 30s and even 20s having colon and rectal cancers. And this phenomenon is worldwide. We've seen it with our colleagues in the UK and Europe, as well as in Australia and Asia. And we are quite concerned that we don't understand what the underlying basis for this change is. But it does mean that we need to start screening patients earlier. And so I would encourage all your viewers out there to, if you have family members who turn 45, who've not had a previous screening, to please talk to the doctors about it. And I would actually go beyond that and say that if you're younger than 45 and you have symptoms of bleeding during bowel movements or a change in your stool that is not explained easily, do seek medical attention and advice, because you will be doing your family and yourself a big favor if this is identified early and we can treat it.
Absolutely. You touched on this here, but I mean, over the past 20 years, we have seen a sharp increase in the number of colorectal cancer cases among younger people, especially people between the ages of 40 and 49. I know you said that the research is still being done, but are there any particular risk factors that we can point to here when we look at this trend?
Yeah, I mean, we don't have risk factors for why the colon cancer is occurring in younger aged people. We do know that colon cancer is associated with, obesity, for example, with a lifestyle that contains a lot of red meats and a sort of non-Mediterranean diet. We know that sedentary lifestyle is associated, but these associations are not as strong. We believe familial associations, if someone in your family has had colon rectal cancer, there's a genetic basis for it. Those are probably the strongest associations with colon and rectal cancer. And that is why it's important for you to talk to family, find out if your family, anyone has had it, seek attention. And if you do get identified with a colon cancer or even precancerous polyps, let your other family members know so that they can also seek screening.
All right, so there are colonoscopies. There are also the stool tests that are done as well. What type of colon cancer screening do you recommend? And on top of that, doctor, how likely is that screening to potentially save someone's life?
Absolutely. So the gold standard is colonoscopy. And this is because colon and rectal cancers are unique in the sense that we can not only detect them early if we do the right screening technology, but in patients, because most colon cancers arise from precancerous colon polyps that can be seen on colonoscopy, with a colonoscopy, you can actually identify the precancerous lesion and remove it and prevent it from ever becoming a cancer, which goes beyond just identifying a cancer early. So the gold standard is colonoscopy, but I do understand the resistance of patients to have colonoscopies. It's invasive, it requires a bowel prep. And so at the very least, for patients who are unable to get a colonoscopy, they should get a galled blood test or a fecal DNA test. And these should be repeated for 2 years in a row to have at least somewhat the same level of detection as a colonoscopy would.
All right, great advice. Really appreciate you taking the time to come on here and talk about this shift in the guidelines. Dr. Ankit Sareen, appreciate you doing it. Thank you.